My name is Alyssa Brooker, and this is my informative speech. In my opinion, pregnancy is the most amazing process that a woman will ever endure throughout her lifetime. As a future mother, I feel it is my right to speak on this topic because I care about children very much and I've done a lot of research on it. I am going to do everything that I can to have a healthy baby each time that I'm pregnant, and I have plans of having many children, and it is important to me to know what's going on within my uterus while I'm pregnant. The development of the child is a complex, amazing process. During the first month, the fertilized egg will attach itself, called implantation, to the uterine wall, and by the end of the first month, it looks something like this. During the second month, the embryo will actually start producing its heartbeat, and it will actually be able to be heard throughout the ultrasound. It will produce its limb buds and finger buds and toes buds on its hands and feet, and looks something like this. During the third month, the bones will harden, and it's called calcification, and its eyes will open and its ears will form and look something like this. During the fourth month, the teeth will form. You will actually be able to see a hair pattern on the ultrasound or the sonogram, and sometimes you're able to see a little bit of the genitalia, but it's not very viable. During the fifth month, the baby will start producing its own fingerprints, and sometimes the mother is able to feel the baby moving, even though it's only about 9 centimeters long. During the sixth month, the baby will start producing eyebrows and practice breathing for birth, and it's something like this. During the seventh month, the baby's body will start depositing fat throughout the body, and it will start forming eyelashes, and will actually be able to hear the mother's voice, heartbeat, and digestive system. And it has been reported that the baby can hear something similar to what we can hear in a pool. By the end of the 8th month, the baby's body is actually making all of its red blood cells. Red blood cells are used in the blood to carry oxygen throughout the body. The baby also has fully formed fingernails and can open its eyes and close its eyes at its own will. During the 9th month, the lungs secrete a hormone that helps the lungs expand at birth, and the kidneys are functioning very well, producing about a half of a liter of urine each day, and the baby will actually urinate into the amniotic fluid, which is the fluid inside the sac that the baby is living in. And the baby should look something like this by the 9th month. Once the baby is able and ready to be born, you will undergo birth. Birth is the process of having the baby come from within the uterus out into the open air, and the baby will start breathing on its own. Next, I'm going to talk about a scale that is used in hospitals by midwives and nurses that helps assess your baby's health at birth. It's called the APGAR scale. It's a simple, effective way to measure your baby's health and measure whether or not the baby needs immediate medical attention. It's quick and painless for the baby, and is measured after 1 minute after birth and 5 minutes after birth. Things like its appearance, whether it's blue or purple or red, will be assessed. Its heart rate or pulse is whether they can find a heart rate, and if it's very faint or very, very apparent, its reflex response, or how it responds to someone pricking its toe with a needle or poking its toes. Its activity level, so whether or not it's crying or whether it's just quiet and not moving very much, is assessed. And lastly, its breathing is assessed. If the baby isn't crying, usually that's kind of a heads up that there may be something wrong, but not in all cases. And they look at how much the lungs have expanded and how well the baby can breathe on its own. A score of 10, 9, or 8 means that your baby is in good condition and does not need any immediate medical attention. A score of 5, 6, or 7 means your baby's in fair condition and may need some help breathing. And a score of 5 or below means that your baby is in poor condition and needs immediate medical attention by a pediatrician. The pediatrician will be called immediately, and your baby will be assessed by him or her. So the development of a child from conception to birth and thereafter is an amazing process, a very quick process when you look at everything that happens from going from the sperm and the egg to the actual birth of the baby. It's amazing how much happens in that process. And things like opening its eyes on its own and bone marrow producing red blood cells and eyelashes growing. It's awesome. And after birth is crucial to getting the baby out and into the world and healthy, and it's important to assess the baby with that Apgar scale just because it's quick and painless, and the baby has a greater chance of being healthy in the future if it is assessed right away. And that is my informative speech. Thank you, and I hope you enjoyed.